Good afternoon, how's everyone doing? Do we need to take a stretch break? Why don't we all get up and take a stretch break? So I have the difficult challenge every Ramses to follow my esteemed colleagues that go over everything that I'm supposed to talk about in my presentation. So, I figured, why don't we talk a little bit about how can we go beyond the robot in infertility and as a society overall. But just to make the board happy, I will go over some of our data. And this is the awesome water fountain here in the middle of Geneva. And when we started doing robotic assisted microsurgery, actually when Sijo started this almost 8 years ago, our water fountain was very short. And we've only risen as the years have gone on. Every year our data gets larger and larger and larger. And so now, as of, it should be up to August 2015, we've done over 740 denervations, 280 reversals, 305 ergocolectomies, and 22 microteses. So the number of robotic microsurgical procedures has gone up significantly in our practice. So what about ergocolectomies? You guys saw some amazing videos earlier, so I'll spare you our videos, but we've done about 305 ergocolectomies, and with a median follow-up of 36 months. We've had 30% of these patients convert from azospermia to oligospermia, 80% significant improvement in patients that have oligospermia. And then we do a lot of these jointly for management of chronic testicular and groin pain. And our data shows significant outcomes in terms of reduction of their pain as well after ergocolectomies. Are we any better than my esteemed colleagues? No. We just started a little earlier in the process, and they will, I'm sure, soon catch up. And as you can tell, our data is very similar. So this is definitely something reproducible. Sijo was microsurgery trained. I was trained under him. And then you were not, but everyone's data is the same. So I think earlier this discussion was, what is the benefit and the advantage of using the robot? Well, this is it. We're able to get excellent outcomes with different training experiences. From a vasectomy reversal standpoint, we've done about 280 vasectomy reversals. Of those, about 2/3 were actual vasovasostomies, and 1/3 were vasoepididymostomies. Sometimes we get asked, why are you doing so many vasoepididymostomies? Well, we end up seeing a lot of the complex reconstructions. We just got an email while we were here. A guy's 12 years out, already had a reversal, and now wants to come see us for another reversal. So, we see a lot of the more complex patients, and I think that's why we see a few more epididymostomies. So our patency rates for vasovasostomies is about 96%, and vasoepididymostomies is about 56% from our reversal data. What's really cool and neat is we're always trying to find new ways to incorporate the robot into our practice. And we've had 4 patients that have had iatrogenic injuries to their vas, and they had hernia repairs. All of them had hernia repairs on both sides with mesh, and it was very difficult to actually bring enough length of the vas out to do a routine microsurgical extracorporeal vasovasostomy. So we did the first in New Orleans. Sijo went down, and since then we've done 4 in our practice, and we have a 100% patency rate, which is amazing, because these guys usually would have no options other than testicular biopsies and IVF. Now, pregnancy rate none of them have gotten pregnant yet. I'll be very honest with you guys. But their odds of having a natural pregnancy are higher because they do have sperm in their ejaculate. So what has changed since we gave this talk last year? Well, our hospital bought an XI. We did not push for it. Our hospital bought it, and now we've kind of been forced to convert a lot of our cases from the SI to the XI. So, what are the advantages of using this new technology? Well, if you look at the Intuitive website and all the marketing, there definitely are advantages to having the new robot. There's anatomical access from everywhere. You can put the robot anywhere in the room. The visualization is a lot stronger. And you can put your camera, as you can see here, into any of the arms of the robot. On top of that, it just seems like a more ergonomic system. But for us, when we set up our patients, we're setting them up pretty much the same. We use the same instruments. And hopefully next year Intuitive will have newer instruments that we can use, which we're not allowed to talk about since we signed a non-disclosure. But we're still using the same instruments, using some of the same lenses, and we're using the same platform. But what the 2 advantages that we found is, number one, we can basically put the robot anywhere. Before it was very difficult to manipulate the robot exactly where we need it to, but here it doesn't matter if the nurse is bringing it from the right or the left, we can always bring the arms the way we want to. Number two, what we found is for our vaso reconstructions, the visualization is amazing. It is so much crisper. It's kind of like going from a old TV to a 4K television. I mean, you're able to see a lot better, and I feel like that makes us more efficient. But with any new technology, you have to think, what is the cost benefit? Is it worth us investing as robotic-assisted microsurgeons into an XI just for the few things that I mentioned? I would say probably not. Again, we were put into the situation because of the way our hospital bought it. Outcomes-wise, I would say our outcomes are probably going to be very similar. They're definitely much more efficient. We can dock the robot about 5 minutes faster, and we haven't really, we're compiling our data now, but our reconstructions are going a lot faster too. I would say almost about 20 minutes. Now, is it worth investing in this machine? I think that is a big question for the audience. As of now, I would say no, because I think the outcomes in the end, from a quality and outcome standpoint, are going to be very similar between the two machines. So, overall, as robotic surgeons, I want to take some time to talk about, why Ramses is so amazing. So you see the number of penguins up here, and when Ramses actually started, there were only about 5 penguins on that iceberg. And as we've grown, now at 5 years, the number of people on that iceberg has gone up exponentially, as you can see here by the number of people in this conference. And that shark in this case, are the people that were the naysayers. And actually those sharks, the more of us out there, the sharks are actually getting larger. But the reason we've been able to progress and continue to innovate is just like those penguins stayed together and thought same. We are doing the same as a society of Ramses. And we're doing everything we can to stay together and continue to innovate and continue to push the envelope in a safe manner for our patients. So it doesn't matter what shark is going to get in our way, whether it's the Journal of Urology rejecting our paper or whoever it is, we're going to be able to accomplish what we've meant to accomplish. But what makes our society even more amazing is we're not just thinking about technology and robotics. We're thinking about the surgeon and we're thinking about the patients as well. These are alarming statistics from the United States alone, and these statistics probably can be extrapolated globally as well. 54% of physicians don't want to be a doctor if they were asked to do it again. 9 out of 10 doctors, if a student comes to them and says, no, don't go into medicine. Suicide rates in our population are twice the normal population. There's going to be a national shortage of physicians, not because I think we don't have enough spots or anything, but I think most people don't want to go into medicine because they feel like they're going to burn out. So what Ramses has done, which I have to applaud the board, because they truly are visionaries, is let's just not think about the robot. Let's think about how we can innovate the health of our surgeons and our physicians and our patients as well. So it's all in the hands. Just like we manipulate the robot, Ramses has been able to, with their hands, advance technology, surgeon, and patient. And how we do it with our hands is going to be a talk that Dr. Kazarian is going to give tomorrow. But I just want to tell you guys about 2 events that Ramses held last year that were very successful in terms of engaging a larger audience. The first, everyone's asking, when is the Shave-a-thon going to happen this year? Well, last year, what Ramses did, we had our Shave-a-thon. So Movember is a huge campaign. They raised over $650 million in the US alone. They've raised almost $1 billion globally. For men's health initiatives, and we actually held our own initiative last year, and we used the robot to actually shave a lot of the board members and my face as well. So it's just an innovative way incorporating other things we can do to raise awareness while we are here at this conference. Another way is Ramses is actually the main coordinator and the main nonprofit entity behind the Drive for Men's Health. Now, Dr. Kazarian is going to go over some of the details of the social media aspect of it. But I just want to show you guys a really cool video, because a lot of people talk about, oh, you guys drive the Tesla around country. But it's really hard to explain, because when we say it, you may not understand it fully. But when someone like Sanjay Gupta explains it to you, you may kind of listen a little bit more.
This may look like a scene from Bill and Ted's Excellent Adventure.
Dude, you're up, man. Thank you so much.
But these 2 dudes are doctors. Dr. John Dr. Brumbaugh.
You like being heard about.
On a 6,000-mile road trip from Florida to New York, and then across the country to Los Angeles. They're on a mission to raise awareness about men's health, or as they say, to save the males. So why do males need saving? Well, the truth is we, are not so great at taking care of our health. Now, the idea for this road trip began with a survey done by a Florida health practice. It found that less than half of men could actually remember the last time they'd seen a doctor, but 80% could name the make and model of their first car.
My first car actually was an Econoline 154 Dodge Shadow.
318 BMW. Mine was a Toyota Camry.
Mine is a Nissan Sentra 88.
So they got the coolest car they could think of, the all-electric Tesla sedan, and they hit the road.
And so we realized that, wow, this car acts like a magnet, and just really, makes people comfortable to talk to you and connect with you. So we thought, well, what if we take this to the next level and go all across the country, and we could basically engage with, millions of guys out there.
This is groovy.
Dude, this engine is amazing. Ready? Whoa!
In cities across the country, they are bringing their message to men who come to see the Tesla, and also to millions more on social media.
We are on Periscope here, hanging out with everyone.
Their message to men: take as good care of your body as you do your car.
You know you're supposed to get your oil changed, you're supposed to get your belts changed, and you're supposed to get your battery checked in the Tesla. You go and do it because you want to get the full 100,000 miles out of that car. Your body is exactly the same way. If you see a rash, if you get a headache that doesn't go away, if you see blood in your urine, you should go get checked out. The only difference between you and a car is you can always go rent a car or get a new car. We only get one body.
Studies confirm women pay more attention not only to their own health, but to the health of their families as well.
Being a man, yeah, I'm lazy to go to the doctors, and my wife pushes me all the time.
Even Dr. Brumbaugh admits that it's his wife who needs to push him to see his own doctor.
I'm like, no, your life is not just yours. It belongs to me, it belongs to your kids, to your parents as well. You owe it to them. You take care of yourself, not just for yourself.
A message they say all men need to hear. With Everyday Health, I'm Dr. Sanjay Gupta. Be well.
So what I encourage you today is we're learning about all these amazing technologies, and we're getting more and more professions involved in incorporating robotics into their practice. But at the same time, we, as innovators, also need to think about innovative ways to improve the overall health of our patients and our health as well. How can we stay mentally strong? And how can we ensure that our patients stay in the most optimal health? Whether it's an idea like driving a Tesla across the country, or getting on social media, or creating a new robot that's going to help everyone out there in terms of cost. Whatever it is, figure it out. And if you need support and ideas, the Ramses board is more than willing to help you with an open mind and a healthy body. Thank you very much.